Chase team has reached Marissa Lennox in Toronto. She is Chief Policy Officer at the Canadian Association of Retired Persons. Marissa, I'm glad you're taking the time to talk to us. I want to get right to it. Long-term care homes. I mean, from the outside, you can imagine what makes them so vulnerable to outbreaks like this one. What is it we don't know?
Well, what's interesting about this case is it wasn't exactly a long-term care home. It was a retirement home, which means that the residents were paying top dollar for their bed. And I think, there's a bit of a misconception in the public that somehow retirement homes are safer because you're paying that top dollar, as evidenced here. It's not the case. We don't know a lot about this particular circumstance. Some of the things that we should be doing regularly in long-term care homes and in retirement homes is certainly more rigorous and systematic testing. That would certainly help control some of the outbreaks in these homes. And
testing only during a pandemic, or you're talking about all the time? Testing for influenza, testing for this and that?
It's a good question. Certainly during this pandemic right now, we know that there's a shortage of tests and there's a backlog in trying to access them. Homes are, have been raising these alarms for some time. The provinces across the country are obviously aware of it. Ontario, Quebec, even BC have said that they're going to be doing and conducting more systematic testing in some of these homes. And so I think certainly during a pandemic, there needs to be more rigorous testing for COVID-19, that's for sure.
And when you heard about what went on at the Heron Residence there in Dorval, Quebec, what is it that was your first thought?
The utter and shocking disregard for human life. It was just really one of disbelief. And it's one thing for a home to say your loved one has passed away and we did everything humanly possible to make sure that that person was cared for, was loved, and so on and so forth. And we were certain that we took every step possible to meet their care needs. In this case, the families are now learning, based on the details that are coming out, that wasn't the case, that there was a disregard for human life. They found urine bags spilled on the ground, people left in soiled beds for days, not fed, unbathed. It's horrifying, something you might expect in a concentration camp.
You're angry, obviously.
I am. I'm angry because a lot of our members are fearful for their loved ones that are in long-term care homes and in retirement homes across the country. And this type of thing shouldn't happen. It shouldn't happen. Obviously, the circumstances regarding the case at the Heron home are unique insofar as clearly there was gross negligence on the part of the operator, and I'd be remiss to speak out of turn because we don't know the full details of the scope of the investigation.
Right.
But what we do know is happening across the country is a chronic shortage of staff. And these things put residents at risk when there aren't enough staff there to meet the needs of residents, particularly in long-term care when their needs are so high.
Marissa, we're going to hear from cabinet ministers, particularly about this issue, long-term care, our most vulnerable, or some of our most vulnerable, being the elderly. What do you want to hear from those cabinet ministers?
I'd like them to take an honest look at staffing in our homes, in our retirement homes, in our long-term care homes. I want them to commit to increasing the number of staff and making sure that those staff aren't jumping from home to home. That also puts residents at risk, whether it's long-term care home to long-term care home or private residence to retirement home. Now, we do know that provinces are moving in that direction, BC, Ontario, Quebec, which is a good thing. That's a good thing, but it should have happened before. And frankly, I will say it's regrettable that we're even having a conversation about staffing right now, because this is an issue that has plagued our retirement homes and long-term care homes for years. And it's just so unfortunate that it took a pandemic to bring it into sort of a national conversation.
I want to thank you for your time, Marissa. Great to have you on the program, and you stay healthy.
Take care. Thanks for having me.